Hi and Assalamualaikum warahmatullahi wabarakatuh. My name is Nazrin Najib and I'm from SR1155B1, and today I will be presenting about the cardiovascular system. So, what is the cardiovascular system? The cardiovascular system consists of the heart, blood vessel, and blood. Its main function is to carry nutrients and transport oxygenated blood. It also carries the oxygenated blood from the lungs throughout the whole body and repeat the same process over and over again. So now we are going to talk about the anatomy structure of the cardiovascular system. The cardiovascular system structure consists of three components. Firstly is the heart. The heart pumps blood throughout the whole body, and it has two sides and also four chambers. Secondly is the blood vessel. The blood vessel consists of arteries, arterioles, capillaries, venules, and veins. And lastly is the blood. The blood is red in color. We are moving on to the anatomy structure of the heart. We are going to talk about the size and location of the heart. The heart is cone-shaped and is about the size of its owner's face. It is located in the center of the thorax and it is positioned obliquely. As we can see in this diagram here, we have the heart. The heart consists of the superior vena cava, pulmonary veins, right atrium, tricuspid valve, right ventricle, inferior vena cava, cardiac muscle, left ventricle, mitral valve, pulmonary valve, left atrium, pulmonary vein, pulmonary artery, and aorta. There are several functions of the cardiovascular system. Firstly, we have the distribution functions. It is to deliver oxygen and nutrients to the body tissues. Secondly, we have the regulation functions. It is to maintain body temperature and control constant blood pH. Thirdly, we have the protective function. It is to prevent infection and hemostasis. And last but not least, we have the removal functions. It is to remove carbon dioxide and also metabolic waste. So we are moving on to the blood flow in the cardiovascular system, which is the circulatory system. Firstly, we have the pulmonary circulation. It carries the oxygenated blood from the heart to the lungs, where carbon dioxide is removed and oxygen is added. Then it carries oxygenated blood back to the heart. Secondly, we have the systemic circulation. It supplies the tissues of the body with oxygenated blood and also returns the oxygenated blood to the heart. So, what are the differences between the pulmonary circulation and the systemic circulation? The pulmonary circulation carries the oxygenated blood from the heart to the lungs, and it also carries oxygenated blood from the lung back to the heart. Whereas the systemic circulation carries oxygenated blood from the heart to the body tissue and carries the oxygenated blood from the body tissue back to the heart. As we can see in this diagram here, we have the pulmonary circulation at the upper part and the systemic circulation at the lower part. The pulmonary circulation carries blood from the heart to the lungs and also carries blood from the lungs to the heart, whereas the systemic circulation carries blood from the heart to the body tissue and body tissue back to the heart, and it repeats the same process over and over again. So now we are going to talk about the abnormal heart conditions. Firstly, we have the arrhythmia. Arrhythmia is an irregular or abnormal heartbeat. There are several types of the arrhythmia. Firstly, we have here is the tachycardia, which is a fast heart rhythm with a rate higher than 100 BPM. Secondly, we have the bradycardia. It is a slow heart rhythm with a rate lower than 60 BPM. Arrhythmias can show symptoms such as palpitations, which is the feeling of skipped heartbeats, pounding in the chest, shortness of breath, chest discomfort, and also body fatigue. So what causes arrhythmias? The cause of arrhythmias can be coronary artery disease, high blood pressure, healing process after a heart surgery, and also valve disorders. So the second abnormal heart conditions that we have here is atherosclerosis. It is an arterial disease, which is a disease that occurs when plaque builds up inside the arteries. The arteries get hard and narrow, which can block blood flow and lead to heart attack, blood clot, or stroke. So what are the symptoms of the atherosclerosis? There are no symptoms until an artery is very narrow or entirely blocked. Atherosclerosis can be caused by several things. Firstly, that we have here is smoking, high cholesterol, high blood pressure, and high blood glucose. To conclude everything that we have talked about, the cardiovascular system consists of the heart, blood vessel, and blood, which works together. The conditions such as arrhythmias and atherosclerosis is a very dangerous disease. So to avoid getting the disease, we should live a very healthy lifestyle. That's all from me. Thank you very much, and Assalamualaikum warahmatullahi wabarakatuh.